When we think about fighting the next big global health crisis, we usually picture scientists in labs. But what if our greatest weapon isn't a vaccine, but an algorithm? Today, we're diving into a new, absolutely vital role, the AI engineer in public health. These are the experts turning massive amounts of data into our first line of defense.
So why is this so critical right now? Well, it's because public health has completely changed. It's not just about doctors and hospitals anymore. Now, it's a battle that's fought with information. We are literally facing a tsunami of data, and we need a whole new way to make sense of it all.
And this all boils down to the single most important question of our time. With all this tech, with all this information flying around, how do we actually get ahead of the curve? How can we spot those tiny, faint signals of a new threat before it's already too late?
And just to give you a sense of the scale we're talking about, think about this. Every single day, we generate zettabytes of health data. A zettabyte, that's 1 trillion gigabytes. It's flowing from everywhere, our electronic health records, the smartwatches on our wrists, genetic sequencing labs. It's a huge, monumental challenge for sure, but hidden inside all that noise is an incredible opportunity.
And this is where our hero, so to speak, enters the picture. The one person who is uniquely equipped to turn all of that data chaos into life-saving clarity is the AI engineer.
So what is an AI engineer, really? Put simply, think of them as an architect of insight, or maybe a digital detective. They're the ones who build these intelligent systems that can sift through mountains of complex data, find the hidden patterns, and, most importantly, predict what's coming next.
Okay, so that's the high-level idea, but let's get into the weeds a bit. What does a day in the life of one of these AI engineers actually look like? Well, it's really all about taking raw potential and forging it into practical, life-saving tools.
Their workflow is basically a journey from total chaos to crystal clarity. It all starts with step one. They have to collect and clean these huge, messy data sets. Because, the saying, garbage in, garbage out. Then comes step two, which is where the real magic happens. Building and training the AI models. This is where they teach the machine to recognize the things that matter, like the early warning signs of a new outbreak. And finally, in step three, they get these tools out into the real world, constantly monitoring and tweaking them to make sure they're actually saving lives.
And that whole process leads to some incredible real-world applications. I mean, look at these. We're talking about systems that can predict disease outbreaks, sometimes just by scanning what people are searching for online. They build AI that helps create personalized medicine, tailoring treatments right down to your unique genetic code. They design tools that can analyze medical images, like X-rays, with a level of accuracy that's frankly superhuman. They even develop systems that make hospitals run better by optimizing logistics, making sure critical supplies get where they need it most.
Okay, so where do these digital detectives actually hang their hats? Well, with a skill set this vital, it's probably no surprise that there's a huge demand for them across a few key sectors.
You'll find them working in government agencies like the CDC, right on the front lines of national health defense. They're deep in academia, pushing the boundaries of what's possible in university research labs and medical schools. And of course, they are all over the private industry, from tiny, nimble health tech startups to giant pharmaceutical companies and major hospital systems. They're all trying to build the next generation of healthcare.
So this is all really fascinating from a tech point of view, right? But what does it actually mean for you, for me, for our families? Why should we care about what an AI engineer in public health does? Okay, this is what it's all about. Just look at the difference here. The old-school, traditional ways of detecting a disease outbreak, that could take weeks, sometimes even months. But with these new AI-powered systems, that detection can happen in a matter of days, sometimes even hours. And that time we save, that isn't just a number on a chart. That translates directly into lives saved.
So here's the crucial takeaway. The work these engineers are doing creates this powerful chain reaction. Faster detection means a faster response. A faster response leads to much better prevention. And better prevention is what creates safer, healthier communities for every single one of us. This isn't science fiction anymore. This is the future of public health. And it's happening right now. And that brings us to a final thought to leave you with. As this technology gets even more powerful, what's the next great public health challenge we should aim it at? Should it be mental health, chronic disease, maybe global health inequality? The possibilities are really as vast as the data itself. If you found this breakdown interesting, let us know what you think in the comments. We really do read all your feedback to help us figure out what to cover next. Thanks for tuning in.